Hi, my name is Gabrielle. For my final paper, I chose to do a literature review on the issue of patient record access. Just a general summary of what my research entailed. So, there have been a lot of recent changes in patients' healthcare record access due to access of online records. And these records are a valuable form of communication and they give information to healthcare consumers. The changes that have been made recently cause more change in communication between patients and their care providers, which has both impacted social determinants of health and had impacts on communication, both positive and negative. So, just to summarize a brief literature review, physicians had several different viewpoints, physicians and primary care providers. So, care providers viewed this as an increase in sharing of information that also increased adherence to, treatment regimens and clarification, and increased quality control. It provided a base of clarification during verbal communication. And then a lot of providers actually expected there to be negative consequences from viewing records online, but these consequences actually did not come true. Patients also had several different viewpoints about viewing their records. So, one study of oncology patients showed that they wanted access to all their records, regardless of whether or not they could actually be understood. And in Sweden, a lot of patients viewed record access as a positive reform, and they actually wanted the records within 1 day after visiting doctors, but there were inconsistencies with signed and unsigned medical notes because some physicians want to wait for records to be signed off on because they'll contain errors otherwise. But patients just wanted their records regardless. So 84% of patients, they felt that their online records improved communications, but actually only 31% of patients said their records were discussed with them, showing that the records actually probably need verbal clarification. Another common theme was that verbal communication alone wasn't enough, but neither was access to online records because patients didn't know, they weren't sure what should be shared, when it should be shared, and they weren't sure about the security of their records. And it was also found that sharing records might increase health disparities across race and ethnicity, literacy, and education levels. And then the insecurity of records ultimately causes a distrust and a lack of communication because patients don't trust their physicians when they think that their records aren't, secure enough. Some general consequences of online record access and electronic record access is that electronic records might not always be up to date because, visits happen and then, the records aren't signed off on and patients don't see their most recent visits and they get confused. And, this kind of communication can be helpful, but when it's not, up to date communication, then it causes more confusion. Patients also use the online information they found in their records to challenge their providers and to give them some kind of pushback, which does make further problems in communication. And then a positive note was that patients felt like having the records gave them more control over their lives and also clarity in general on what was going on. And also, again, like I said before, people who accessed their online portals were actually more adherent to treatment because it allowed clarification of messages that their doctors had previously told them. Electronic record access has solved several communication issues. So one example is that in 2013 in Rochester, one doctor actually lost a flash drive that had 537 patients' medical records. But electronic records were again saved elsewhere. So if he had lost paper copies of these records, there would have been a lot more severe consequences, but fortunately, having records saved online saved this. Also, when there are electronic copies, multiple caretakers have access to medical records, like in the case of parents. And then there were also communication issues caused by electronic records. Like I said before, there's concerns about confidentiality, and then also the records can be internal within a company, but they can't be shared between care providers. So that causes problems with continuity of care. And then again, health literacy is a big problem because most medical records are at an 11th grade reading level, whereas Americans read at an 8th grade level. Some themes were noted in terms of social work records. Patients thought these were kind of a source of memory and identity for them, but the records weren't completely trustworthy because they contained errors, and then some records actually had redaction present. And when patients saw these errors and the redaction, it caused distrust of their care providers, which worsened their communication between them because they withheld information from the providers afterwards. Additionally, most providers said that they gave patients record access, and most actually believe this was good practice, but few providers actually gave access to records, and only 69.2% of providers actually even told patients they had records available to them. So it's interesting that is kind of like a meta-communication issue where there are communication problems about the communication of records. So a brief literature analysis of all of the articles that were reviewed is that there were found to be overarching effects on social determinants of health. Specifically, providing more information had the potential to increase health communication and patients' education on their medical conditions, which increased the quality of their care overall. So right there in that first bullet point, there's 3 social determinants that were addressed because of communication of healthcare, patient education, and quality of care. An improvement in care could also reduce healthcare spending because of less repeat visits to physicians and more efficiency, which would lessen debt, which is another social determinant, and also improve financial status, another social determinant. And then another thing that can be noted was that allowing patients to have access to electronic records lets them share their records with their loved ones who might not be able to make it to appointments with them. And that allowed them to have more social support and support when making decisions. So that's another determinant. It was also noted, though, overall that record access could increase health disparities because people are affected differently by social determinants. So lower education level and less language comprehension or, understanding a different language altogether reduces health literacy of the records. And people without the social support of family or friends to help them view records, they don't have help interpreting the records or making decisions about their health care. And then also a lack of financial resources could lead to substandard care and cause patients to visit physicians that have poor record systems. So patients would have less understanding and less communications in their records overall. It was noted that record access can improve communications by letting patients fact check basic information about, their demographics and their medical history, clarifies verbal communication that's already been, communicated to them. It can cause them to feel empowered and have a sense of control, which would help them make decisions along with their physicians. And again, it increased treatment adherence and can increase trust when they see their records clearly documented. There's overall quicker communication because records can be updated automatically rather than having to give paper copies out. And then also communication to multiple audiences is available. When, one paper copy can be given to a patient, but allowing, family members to have passwords for the records allows communication to multiple audiences at once. There have been a couple ways that record access online has worsened communication because patients can't interpret the records, which, when they see them and they don't understand them, they don't participate in shared decision making with their physicians. And, a lot of providers can assume that patients understand their records and they don't need any further explanation. But patients don't speak up about the fact that they don't understand it because they might be embarrassed about it. Also, redaction and errors in the records cause distrust, and misinterpretation of records causes distrust. And when patients don't trust their care providers, they stop communicating. And then patients also know that records aren't up to date, and there's the problem that, there are unsigned physician notes that are never signed off on and just kind of fall into a void, and patients can't access those, and that causes further communication confusion. So some future directions for electronic records is that there need to be formal policies for the provision of records that, tell patients that they'll have their records within a certain time period and that notes will be signed off on within a certain time period. There need to be policies that are clear and stated to patients so they understand why they might not get their records immediately, to eliminate distrust of their care providers and frustration with them. There also need to be policies for record disclosure because some patients had to, jump through hoops by filling out a formal request for records. Some just had to fill out a piece of paper to get their records. Some had to pay a fee for their records, and the fees aren't standardized, which causes more communication confusion, and then, just a snowball effect of reduced communication and trust of their providers from there. Also, with electronic records, there have been advancements, but with more technological advancements, there could be greater care accuracy and a reduction in medical errors from there, based on electronic advancements to patients' records. Finally, just the research implications are that it should be determined how to merge records in a way that could provide the clearest information to patients and provide continuity across providers from multiple organizations. And so just one standard overall record per patient for every healthcare organization would be the ultimate goal. And it needs to be figured out how that can happen because it's really complicated with multiple care organizations. Research needs to be done in order to see how to make records secure, because giving electronic record access to patients also makes it easier for other people to see the records as well. And not all providers understand HIPAA privacy rules about records, so it should be determined how much they actually know, as well as more research needs to be done on overall health literacy of patients and the different factors that affect it in order to determine how the records can be clearer to the patients. Overall, the key takeaway from this research was that understanding of records is different based on, social determinants and context, and it should never be assumed that patients understand something. It should always be verbally clarified, so multiple communication forms are the best way to go. Records are really powerful when you think about it. They could save lives, and they should be used to the best of their ability. And then here are just the references. Thank you for listening to my presentation.